Thank you for that wonderful introduction, and good evening and happy St. Patrick's Day to everyone. Hope you're all having a wonderful day and a wonderful evening. Once again, thank you for joining us. One of the more common concerns we hear from pet parents is about anxiety, especially separation anxiety. With adoptions at an all-time high, and pet parents working from home, the concern I hear a lot is for how is their fur baby going to do or adjust to them going back to work, actually leaving the home office and going back to their actual full-time job. Many of us in the veterinary profession are hearing more and more of this. I imagine all of you are also. Um,
Hey, Dr. Shapley, I'm sorry
yeah.
to interrupt. It looks like your sound is kind of fading in and out.
Oh, is it?
Yes, I don't know if it
Um,
might be your microphone.
it might very well be. Let me see.
Okay,
All right, is this better?
much better. Yes, thank you.
All right. So sorry about that, folks. How about I just start from the top? So once again, good evening, happy St. Patrick's Day to everyone. As I was saying before, one of the more common concerns we hear from is regarding anxiety, especially separation anxiety. So with adoptions at an all-time high, pet parents and pet parents working from home, the concern for how their pet is going to adjust once they go back to the office, it's something many of us veterinary professionals are hearing more of. This presentation will hopefully give you some insight into some non-traditional or non-conventional modalities. Okay. So the goal of managing anxiety in companion animals is aimed at improving the quality of life of the patients and the pet parents by alleviating and when possible, eliminating the patient's response to anxiety-inducing stimuli. Traditional modalities for accomplishing these goals have often been limited to behavioral modification, coupled with pharmaceutical agents such as trazodone, alprazolam, fluoxetine, and even gabapentin. This presentation will give a brief overview of some of the alternative modalities that can be used for primary or adjunctive anxiety management, basically helping to bring peace and calm back to the home. So some of the common symptoms of anxiety that we know as veterinary professionals, and we also hear from our pet parents, is pacing and restlessness. This could be fireworks, this could be thunderstorms, this could be just, cars driving by in the down the street, inducing this pacing restlessness. Excessive barking and or whining, especially when we leave the home. Self-harm, such as licking or chewing at themselves. Drooling or panting. Especially I hear a lot about drooling. I'm sure all of you all have also, where the owners come home and their pet is literally in a pool of saliva, panting almost to the point of exhaustion. We also hear about destructive behavior. I was actually speaking to one of my clients yesterday, and he told me that his dog, whenever he leaves the house, flips the garbage can over. Doesn't eat the any of the garbage, but literally chews the garbage can apart. He's had to replace it at least 4 or 5 times in the past couple of months since he started going back to the office. And of course, we hear of house soiling, which is usually urination and defecation in random places throughout the house. And this is often diarrhea. So the behavioral modification techniques that we often, give to our clients or talk to them about is as follows. So what I always tell my clients is practice leaving your house. So grab your wallet or your purse, grab your keys or your coat, leave the house, come back in 10 minutes, 15 minutes, start leaving for longer periods of time, just to basically remind your pet or to teach your new pet that you are coming back, you're not leaving forever. The other important thing to tell pet parents is to not make a production out of leaving. So, I make sure I just, kind of have my keys, say goodbye to Carrie, and leave. I don't, give her hugs. I'm not kissing on her head and say, "Oh, Daddy's gonna miss you," and "I'm sorry for leaving you," and "Oh, it's terrible." I just leave, and obviously, she responds well. We want to ignore negative behaviors. So if they're trying to run out of the house, chasing after you, or as you're leaving, grab something and tries to, chew on it via remote control or whatever. We want to try to ignore and redirect those behaviors. And one of the things that I always recommend, and I consider this part of praising positive behaviors, is when you're leaving, and I do this with my own dog's food bowl, is I have treats that I only give her when I'm leaving the house. And if, she goes over to her dog bowl as she knows I'm going to leave, I will drop those treats in there, and she's perfectly happy. What I also do is I leave on the TV, Animal Planet, Pet TV. I have a lot of pet parents that leave on jazz stations or easy listening. So, kind of breaks up that white noise that's in the background. And, simple act of just leaving the radio or the television on can soothe the pet. I've also advised folks to create a safe space for their dog. So a crate, and of course, never making crates a punishment, or a room that's just dedicated solely to them. So all their favorite toys are there. They have, their favorite their bed, food, water, their favorite treat, just all in this one special area. And again, routine is so key for our pets. So once we, start getting them back into a routine, we'll hopefully see some drop in anxiety. And of course, what I always tell people is exercise, exercise, exercise. A tired dog is a happy dog. So if you can take your dog out for a walk before you leave, throw the ball around in the backyard, whatever you're able to do, or whatever your pet parent is able to do, just to give them a little bit of exercise before you go. So what do we do if just the standard, behavioral modification isn't working? Or what if the pharmaceuticals aren't working? Or you have a pet parent that says, "I don't want to do trazodone or alprazolam. What else can I do?" Unfortunately, to this day, I've yet to be able to teach my dog to meditate or do yoga. I think that would help. But in lieu of that, we'll dive into some of my alternative therapy modalities that I like to use and recommend. So, pheromones. We've all heard about dog appeasing pheromones. Um, these are also known as apazine. And for those that don't know what the dog appeasing pheromones are, they're mixed esters of fatty acids, and they're released by the sebaceous glands in the intermammary sulcus of lactating female dogs. Now, obviously, what they're selling on the market is a synthetic form of this, but dog appeasing pheromones, do have, or studies have shown that they have an appeasing effect on adults and puppies. It assists in establishing a bond with the mother. So having these dog appeasing pheromones basically in your household, again, have shown to reduce the stress and anxiety. So a 2006 study that used dog appeasing pheromones in a clinic setting strongly suggested greater relaxation in dogs subjected to stressful environments. And what environment is more stressful than a clinic setting where they are away from their comfort zone and their pet parents? Another study performed in 2010 showed a significant reduction in inappropriate elimination, excessive licking, and pacing in hospitalized patients when using dog appeasing pheromones. Now, we have to obviously understand that it's not going to be effective in every case, and sometimes it is just an adjunctive therapy. But everything that I'm talking about tonight can actually be used in combination. So just keep that in mind, that we don't have to just do one or the other. We can actually do a combination of things. Okay, calming treats. So we all know that there are several commercial over-the-counter and prescription calming treats, or calming treats that are sold directly to veterinarians. Calming treats typically contain natural calming ingredients such as valerian root, hemp, and chamomile. Many also contain melatonin, um, L-tryptophan, and L-theanine, and these have shown mixed and uncertain results regarding efficacy, but there has been ample anecdotal evidence in these studies that prove definitely more research and clinical trials should be performed. Again, I see these calming treats working really well in combination with other therapies. And of course, we know that there are calming diets. So there are several commercially available and again, prescription diets out there. These typically contain hydrolyzed casein, L-tryptophan, and or L-theanine, much like the treats. And once again, studies have shown mixed and uncertain results regarding efficacy. I personally have had, I'm sure many of you have also have used a particular prescription diet used in cats with stress cystitis. I know I personally have had a lot of success with that particular prescription diet, and have had owners reporting with a combination of feline appeasing pheromones and the diet actually seeing less incidences of stress cystitis and inter-cat aggression in the household also. So this is really my wheelhouse and one of my favorite parts of this talk. It's traditional Chinese veterinary medicine, and most folks are surprised that I can use, or we can use traditional Chinese veterinary medicine, acupuncture, and herbs for more than just osteoarthritis. And I've had a lot of success treating anxious cats, anxious dogs, especially those that are chewing on themselves or scratching themselves or throwing themselves into a tizzy when the owner leaves. Again, with acupuncture and herbs. So with traditional Chinese veterinary medicine, it's not a one size fits all. It's tailored to the individual patient, and anxiety, as we know, is different from each pet to the next. So what's crucial when doing traditional Chinese veterinary medicine and dealing with anxiety is we really need to figure out what our pattern diagnosis is. So in Chinese medicine, anxiety is understood as an imbalance of the mind. So a Shen disturbance or heart yin deficiency or a liver qi excess. And the diagnosis is discovered by identifying the underlying pattern of disharmony. So just for a little bit of reference so everybody understands, the Shen is the mind. The mind is housed in the heart. The liver is the general of the body, so it's in charge. And anxiety can negatively affect heart qi, throwing liver qi out of balance, or vice versa. And also any sort of heart yin deficiency will induce anxiety. And we're basically trying to figure out how the pet is affected, or what is going on: a Shen disturbance, a heart yin deficiency, a liver qi excess, based on our exam. So pattern diagnosis differs from conventional Western medical diagnosis by considering not only the disease signs, but how the signs relate to the individual patient, as I said before. So traditional Chinese veterinary medicine practitioners consider the temperament. We're checking the pulses, the appearance of the tongue. We're looking at the sex, we're looking at the age, we're looking at activity and the environment of an animal, along with the animal's particular disease signs. This approach originates from the belief that the body is an interconnected system of forces, energies, and functions. Therefore, any disharmony must be examined with respect to the whole patient. So acupuncture itself is a form of traditional Chinese medicine that's performed by stimulating acupoints. So the goal of treating anxiety is basically through calming the Shen. As I said before, that's the mind, tonifying the heart yin, or the house of the mind, and regulating the liver qi, making sure that that general isn't dominating and pushing the mind and the heart into deficiency or imbalance. It's highly effective and minimally invasive. So patients often start to relax within the first 5 to 10 minutes. A lot of my clients say, Dr. Shapley, there's no way you're going to get needles into Fluffy. She's bouncing all over the place. She's just way too anxious. And most of the time, after setting the needles and I talk to my patients, I try to give them words of affirmation in a very calming tone about how good they're doing and how we're helping. I often see within the first 5 to 10 minutes, they start to calm, they start to settle, they start to relax. It's also important, there's a point in the top of the head that's called dantian, and that's a permission point. That's a calming point, and that's a point that you can use in dogs, in cats, in rabbits, in horses. I always start off with that point. I always set that needle and then wait a few minutes, wait for the patient to calm down before I start setting the rest of my needles. With other patients, I'm able to put dantian in and they immediately relax, and then I'm able to move forward with no fuss, no muss. I always feel that acupuncture is best used in combination with herbal formulations. Acupuncture alone can work. Sometimes it takes a little bit longer, as opposed to the quicker responses that we often want to see from our clients. I warn them, if we're going to just do acupuncture alone, to give it, a good 3 to 4 weeks before we start seeing those long-lasting calming effects. So different types of acupuncture techniques. So dry needling, that's the traditional form that everybody knows. So we're performing it by introducing a thin specialized needle into the acupoints. And these acupoints have been mapped out, for us thousands of years ago, not just in the human model, but there are some studies and some documents found that practitioners, acupuncturists were using acupuncture in livestock, horses, oxen, close to 2,000 years ago. So these are tried and true methods that have been out there. Oftentimes, if your patient is just shaking the needles out, even after that 5 to 10 minute calming period, and you're doing your best to keep them calm and settled, and words of affirmation, and I often play Tibetan music in the background to drown out all the background noises of the hospital. I try to find a room that's on the opposite end, away from all the action. But if they're still all hyped up and anxious and not sitting for those dry needles, I'll use acupuncture. And one of the really important things to remember when we're doing acupuncture, so we're using a sterile fluid and we're introducing it into the acupoints. We don't want to use B12 in these instances, because B12 is considered hot. And if you have any sort of yin deficiency, you're going to exacerbate, you're going to make that yin deficiency worse, because yang is hot. And we're feeding the yang, and yin is cool, and we're actually starving the yin by introducing something like B12. So I often use sterile saline when doing anxiety at my anxiety points. Okay, we can use moxibustion. These are small cones of dried herbs to basically apply heat safely to the acupoints. I will find that when we have blood deficiencies and actually a yin excess, that the moxibustion will often help, because blood deficiencies and heart deficiencies will actually contribute to anxiety also. And then of course laser acupuncture. And again, this involves the use of low intensity lasers to stimulate the acupoints. This again is another modality. If you're not, if a practitioner is not comfortable doing acupuncture or dry needling or moxibustion, laser acupuncture is also another effective modality, and really considered. And I've done a lot of research on this, and of course, like everything, there's differing opinions, but laser acupuncture is actually considered to be cooling and not heating. So that's makes it, again, a valuable modality in these cases of treating anxiety. So as I said, I love using Chinese herbal formulations in combination with my acupuncture. So these are available in powder, capsule, and tea pill form. Anyone who doesn't know what a tea pill is, they're very, very tiny pills. I use these in cats and very small dogs, like a Yorkie. And it's basically wrapped in, traditionally is wrapped in like a hard shell of like licorice. Again, these are very safe. There's a low incidence of GI upset when they're properly prescribed. The principles of the treatment, like we said before, is to nourish the heart, yin, and blood. So we want to strengthen those. We want to calm the shen and soothe the liver qi. So herbal formulations can be used separately, because I do have clients that can't commit to the once a week acupuncture, or don't want a pharmaceutical, but just want to give some sort of oral nutraceutical supplement herb to help their pet. Again, as I keep on harping about, I do love using herbs in combination with acupuncture. I've seen the most or the best results. So, and any of these rarely are we seeing immediate improvement. It's not going to be, give the pill or give the herb and then tomorrow Fluffy is not anxious anymore. And it often will take 2 to 4 weeks to see reduction or elimination of anxiety. Um, Again, 4 weeks or so when we're not using it in conjunction with acupuncture, 2 to 3 weeks in conjunction with acupuncture. So, what are in these Chinese herbal formulations? These are the common ingredients that we're seeing of most of the herbal formulation, the veterinary herbal formulations. So there's oyster shell, ground up oyster shell. It calms the shen and subdues the liver yang. So remember that the liver yang, the liver being the general and yang being that fire that exhausts and causes imbalance in the shen and in the heart. So it's subduing that. We have Oriental Arbor Vitae, which again calms the shen and nourishes the heart, the house of the mind. Ophiopogon, this again nourishes that heart yin. Poria calms the shen. Scrofularia cools the blood heat. Tangerine smooths liver qi and relaxes tension. And Chinese peony soothes the liver. And I apologize if I butchered any of those pronunciations. Unfortunately, my botany pronunciations are not the greatest, so I apologize. Another hot topic and something that a lot of clients are asking for are cannabinoids. So we know that there's many commercially available CBD formulations and product types. So we have oils and we have capsules out there. I personally feel that the oils are more effective. We also want to make sure that when we are recommending these CBD products, that we're trying to steer our clients more towards oils. And the oils we can just put in, just right in that buccal space, or if they're brave sublingually. And we want that, immediate absorption into a mucous membrane. I often tell folks not to put the oil on the food itself, because the oil, once it's absorbed into food eaten, the stomach acids just neutralize it. The capsules are formulated so basically the stomach acids obviously break down the capsule and activate the contents of the capsule. But again, we can't do that with oils. We always want full spectrum formulas that have been they've been shown to be the most effective. It's really important. Again, laws vary state by state, but we want to make sure that we're finding companies that have third-party analysis as well as a certificate of analysis. So sourcing and purity are critical, and I can't stress this enough, they're critical for safe and effective product selection. So some studies, there have been a lot of human studies that suggest that CBD might have an anxiolytic and antipsychotic effect. So this affects the CB1 receptors. So the effects of CBD on the endocannabinoid system suggest a reduction of anxiety in animal studies also. We're right on the edge of, and this is all still really new. So there's a lot of studies that have yet to be completed. And we definitely need more studies on human models. Most of the studies that I have read, I've been privy to, have been human studies. So I feel like, once it gets a little bit more normalized in veterinary medicine, we're going to have a lot more studies that are going to give us a lot more, obviously, information and help us, kind of spearhead or normalize the use of CBD products. It's also been found that CBD products, when they're used in combination with trazodone, there's actually been an increased efficacy in mitigating anxiety and no increase in sedation. We're not worrying about serotonin storms or anything of that sort. And as I said, we're not having that extreme sedation that everyone worries about, because we have to remember that all the psychotropic effects are taken out of these CBD products. And we also have calming and anxiety compression shirts. I'm sure everyone has seen the commercials. I'm sure many of you have seen clients, or their pets walking in with these on. So the principle behind it is it's much like swaddling an infant. So there's a calming and anxiety, calming sense basically given by applying gentle, constant pressure. And again, the studies have shown that all types of anxiety, fear, and even overexcitement is helped to be mitigated. As I was saying, there are studies that suggest an over 80% efficacy in reducing anxiety for fireworks, thunderstorms, separation anxiety, travel, veterinary office visits, and even excessive barking. And once again, all of these modalities that I've spoken about thus far can be used in combination. So you can have a pet with a calming anxiety compression shirt on a CBD product or on a calming treat or even on a pharmaceutical. And it's about dialing in and finding that right combination to mitigate this anxiety that they're experiencing. And I couldn't talk about alternative methods for anxiety or relieving anxiety without talking about the Calmer canine. So this is a drug-free approach to long-lasting help in regaining and maintaining calm during separation from the owners. This device utilizes targeted pulse electromagnetic field signals to balance the anxious brain. And, anxious brains, as I said, are out of balance. Elevated cortisol levels can lead to inflammation in the brain and even brain cell death. So these signals actually target the amygdala, which is the fight or flight center of the brain. The canine calmer sends targeted pulse electromagnetic field signals to the brain, increasing the production of nitric oxide naturally. And these signals also help to stimulate neural cells to produce serotonin, dopamine, endorphins, those feel-good hormones, again, that help to mitigate that anxiety. So a little bit about nitric oxide. So nitric oxide itself is a potent vasodilator and can potentially influence cells of the immune system as well as the nervous system. So these targeted pulse electromagnetic field treatments have been shown to result in a production of low concentrations of nitric oxide, which are associated with diminished inflammation. So we're reducing that inflammation and enhancement of vasodilation. Okay, and the conclusion to all this, basically the prevalence of anxiety its effects on quality of life and the increasing desire to treat with alternative modalities poses a unique challenge to us veterinarians. People are asking for something other than a pill. It's now possible to safely and effectively improve the quality of life of these patients and their parents without using pharmaceuticals. The modality selected should be tailored to the patient's specific needs and the pet parent's ability to remain consistent in their role as a caregiver. So we need consistency. We need, we need to find that combination or that one product that's gonna do the job. And again, create a happy and healthy, emotionally stable household. Okay, and here are my references, some of the studies that I touched upon for this continuing education lecture. And I'll let you take it from here, sir.
All right. Thank you, Dr. Shapley, for that great
You're welcome.
presentation. We'll give everyone a few minutes to post their questions. I see a couple that have come through, but before we get to that, you talked about the TPMF technology. If anyone is interested in checking that out, we have some specials that are available on the Assisi Loop and the Calmer Canine. So as a thank you for attending this evening's webinar, you can enjoy an extra 15% off of those sale prices with the coupon code CEISFUN at checkout. And with that, let's get right into the questions. First one, can you share the CBD citations for its antipsychotic effects?
Absolutely. If I can go backwards. Stress in subjects, clinical high risk. So that first one right there. Effects of short-term cannabidiol, cannabidiol, on response to stress in subjects at clinical high risk for developing psychosis.
All
So
right.
I'll leave that there for you.
Okay. We'll go on to the next question while everyone is taking a look at those citations. Next one from Sarah. I live in a state where we have been told that we do not have the support of the AVMA or our state board if we recommend or discuss CBD, since there are no studies to prove efficacy and safety. Plus, the veterinary school has said do not recommend CBD. That can be a bit scary to know that our malpractice insurance and those that control our license are against CBD. I have colleagues that still recommend and sell the products, but if there was an adverse reaction, the AVMA malpractice would not support my choices. Do you have any updated information on how the AVMA is approaching these cases?
Unfortunately, I am still running into similar hurdles or barriers, I should say. It was told to me once that by a veterinarian who also is a lawyer, that I am allowed to speak about it. I can discuss it. I can have a frank conversation, but I cannot prescribe it. I often, when I talk to my clients, I let them know, listen, I can't, I'm not prescribing. You asked me about it. I'm talking to you about it. And I was told that it falls under a First Amendment right, that I'm allowed to talk to people about these sorts of things, so long as I'm not saying, giving, you'll see in my talks, I never give dosing out. I never say use a particular product or company. What I'm telling you is basically what I tell my clients, to sort of, I allow them to do their research in that regard. And then we kind of come back and we talk about it. So we have to kind of go a very roundabout way. And I'm in New Jersey, and we're not allowed to prescribe or carry, but my understanding is I'm allowed to talk about it.
Okay. Dr. Shapley, I have a request. If you wouldn't mind showing the second reference slide again.
Oh, absolutely.
Okay, and then let's see, next question. When a dog is old and starts to show anxiety at night, especially, and cries and becomes restless, what is recommended?
So now they I love this question, and I immediately, and I apologize that I'm stalling the answer, because I immediately go into Dr. Shapley, the alternative medicine TCVM doctor. A lot of times we're dealing in cases like that with canine cognitive disorder. So I'm okay with using a pharmaceutical in combination with some Chinese herbs. So I'll use some sort of Shen Calmer, and I'll use Trazodone. If the problem is only at night and the whole house can't sleep. Um, so I think in cases like that, I've had a lot of success with mixing pharmaceuticals and Chinese herbs when I've had to. I've had ample success with owners that have said, I just want to do Trazodone so they sleep. And I'm saying that's fine. Or again, my pet parents that only want to use herbs. There are herbal formulations that I have used and I've had a lot of success with.
Right. Next question. I'm sorry. Living in Southwest Florida, we need help with thunderstorm anxiety. Any suggestions?
So I do I love I've had success with and I'm going to drop the product name, but I've had success with the Thunder shirts. I you know I Up here in New Jersey, we deal with our thunderstorms also. Um, and I've had folks use a combination of the compression shirts and Chinese, herbal formulations. I personally, and again, this is just me. I know there are a lot of veterinary herbal um, companies out there that have amazing products. I don't mention them because I'm not personally familiar with them, but I, having graduated from Chi University, use the Jingtong Pharmacy, and I've used Shen Calmer. I've used Liver Happy in these cases of the thunderstorm anxiety. And being in Florida, I mean, you're not that far away from the Chi University. So there's a lot of great products, and I'll often use a combination of acupuncture, Chinese herbs, and that compression shirt for our thunderstorm phobic dogs.
Okay. Next question. Any considerations for the herbal formulations and cats?
Honestly, the only problem I have with cats is getting them to take the darn herbs. So that's why I tend to go more towards tea pills. But no, these formulations are again coming from the Jingtong Pharmacy, which is my supplier. Very, very safe. The most we'll ever see at any juncture in time is some GI upset. And that's few and far between. And often, if we do have GI upset, I'll back down the dose. And if it's twice a day, I'll say once a day, and we'll do that for a little while to kind of help the gut get aligned. And then I'll have them go back up to their normal, normal prescribed dose.
Okay. Next question. This one's what timeline do you see using the Assisi loop in correcting anxiety?
Isn't it? I thought it was, and correct me if I'm wrong. Isn't it like 4 to 6 weeks?
It is a 4 to 6 week recommendation, and it's 2 treatments per day. They're 15 minutes apiece, and the loop will auto shut off. And this is I think really, if we were talking anxiety, we would highly recommend the Calmer Canine, because that is a different TPMF technology, which is the one that targets the amygdala. So with the Calmer Canine, that would be the 2 treatments a day. And we recommend 4 to 6 weeks, but a lot of pet owners will start to see improvements within the first 2 to 3 weeks. So that would be the timeline that we would recommend to get started with. Let's see. Okay. Sunny is asking about how you'll receive your CE credit. You will get an email within the next day or so with your CE certificate and a link to review the presentation tonight. So if anybody wants to go back and needs to view the citations, you'll have that recording as well. So we'll have that for you. Let's see. Where do you suggest gaining more experience with Chinese medicine if there is nothing near or around me?
So I am doing my herbal certification all online through the Qi Institute. Most of Qi University, I'm sorry, it was Qi Institute when I went there. Now it's the Qi University. So if you go online, the Qi University has a website. They do have online learning. I do believe with the acupuncture course, they are still having what they call their wet labs. So you go down there, gosh, I can't remember. I think I went down there like 3 or 4 times. I know it's a little tough with COVID and all, but it's definitely worth it. I learned so much and I loved it. I really, really did. And it was a game changer for me. I was an acupuncture patient and an herbal patient in my early 20s. From at that point in time, I was doing amateur mixed martial arts. I was fighting on an amateur level, and acupuncture, Chinese herbs really helped my my healing. And I think, as a veterinarian, I couldn't support it more. And if you can at least start the program online, and I'm hoping, we'll be getting out of this, this COVID haze. And I do know that Qi University is having on-site lessons. I say go for it. It doesn't matter where you are. There are places to learn acupuncture all over the country.
Right. Let's see. Next question from Ruth. Ruth is asking what sort of double-blind placebo-controlled studies have been done on the Assisi loop. Ruth, I personally, I don't know the specifics of the studies. I know there were studies done, and I believe those studies can be found at the assisianimalhealth.com website. So start there. And if you still don't find what you're looking for, you can definitely send that question to us at info@assisianimalhealth.com, and we will certainly get the rest of those details to you. Unfortunately, I'm not quite 100% up to speed on those just yet. Let's see. Somebody's asking, how well do the pets tolerate the Assisi loop? I would say very well. There's no sensation that the pets feel while they are being treated. So they tend to get to where they just kind of chill and calm once they get in the routine of getting their treatments twice a day. Once the loop shuts off, then they can go on about their business. So to my knowledge and from what we can see and anecdotal evidence is the pets do very, very well with it. So let's see. Next question. Do you require annually or semi-annually exams and profiles when your patients are on drugs or herbal supplements?
I do want to, well, let me preference that with most of my patients that are on any sort of herbals. I'm also doing acupuncture on them, so I'm probably seeing them at least every 1 to 3 months. For those few cases that are strictly on herbal formulations, I want to see them at least every 6 months.
Okay. Let's see.
And I'm sorry, and I will do blood panels on them. Like I'll do, a large, like comprehensive panel, once a year, and then every 6 months I'll still want to, I still feel like, obviously, since my roots are in conventional Western medicine, I still want to do blood work every 6 months just to make sure that the the herbs aren't having any effect on the liver, which I've never had that happen before. But I'm neurotic by nature, so I like to dot my I's and cross my T's.
Okay. What can you recommend for a cat that has seizure problems due to a kidney problem?
Wow. Honestly, that I feel like is a question for a neurologist, but I feel that's a tough one to answer. I'm sorry because I don't, talk what's causing the seizures. Is it the high blood urea nitrogen? Do we have, you know, do we have kidney disease and a meningioma? Um, I'm sorry. I'm sorry I don't have a good answer for that. I would say I bow to those that are diplomats in cases like that.
Okay. Next question. Is the Calmer Canine Loop available in Canada, Vanessa? I believe it is, Vanessa, but we can find out. Or if you'll send that question to info@ccanimalhealth.com, we can certainly get you that answer. But I'm pretty sure it is. I believe it is. We have distributors up there, so we'll be happy to check on that. Customer service can check on that for you. Okay, great questions. Great
Yeah,
questions.
those are amazing questions. Thank you. Thank you.
We love the interaction.